Hi, pleasant day to everyone. In this segment, we will be talking about anxiety disorder. First of all, if you have not yet been subscribed to this channel, kindly like and subscribe my channel. What is anxiety disorder? Anxiety disorder is a type of mental health condition wherein the person responds to certain things or situation with persistent fear. Anxiety disorder is the most common mental disorder. It affects 30% of adults in some point of their life. It is normal to have some fear or anxiety. And anxiety can be beneficial. Anxiety can help us notice a dangerous situation. Also, anxiety can help us to be careful and not to be reckless. Anxiety can also help us to be proactive, to plan in advance. And anxiety can also help us to be productive because it prevents us from being complacent. It compels us to do things to avoid unwanted consequences. Anxiety disorder goes beyond the regular nervousness and is like fear. Anxiety disorder happens when anxiety interferes with our ability to function. When you overreact when something triggers your emotion. And anxiety disorders happen when you can control your responses to a situation. Who are at risk for anxiety disorder? Certain personalities like shyness and behavioral inhibition may put risk to a person to develop anxiety disorder. Person who has been subjected on stressful or traumatic situations, a family history of anxiety or other mental disorder may predispose a person to develop an anxiety disorder. Also, certain medical conditions like hyperthyroidism and arrhythmias can lead to anxiety disorder. Anxiety disorder are more common in women because it's hormonal. Because we all know that women have hormonal fluctuations through the month. And male have the testosterone, a hormone that promotes aggressiveness. And testosterone help reduce anxiety. So what are the types of anxiety disorder? We have the generalized anxiety disorder or GAD, panic disorder, phobias, separation anxiety, obsessive compulsive disorder, and post-traumatic stress disorder. First, let us discuss the generalized anxiety disorder, GAD. In GAD, you feel extreme and unrealistic worry and tension. Most days, you worry a lot about various topics. And these topics sometimes are just trivial topics like health, work, and relationships. Panic disorder. In panic disorder, you get intense, sudden panic attack, which often features stronger, more intense feeling than other types of anxiety disorder. The feelings of terror may start suddenly and unexpected, or they may come from a trigger. It is described as going crazy. Next type of anxiety disorder are the phobias. Phobias are intense fear of a certain situations or object. The fear does not match the situation. It may cause you to avoid everyday situations. Example of phobias are heights or aerophobia. Another is fear of confined spaces or claustrophobia. Next type of anxiety disorder is the social anxiety disorder or social phobia. In social anxiety disorder, you may have an overwhelming worry and self-consciousness with daily social situations. You may worry about others judging you, may be anxious that you will be embarrassed. Another type of anxiety disorder is the separation anxiety disorder. This disorder mostly happens to children or teens. They worry about being away from their parents. They worry that their parents will be hurt or will never come back. Separation anxiety disorder usually happens in preschoolers. However, older children and adults who experience a traumatic event may have separation anxiety. How common are anxiety disorders? Anxiety disorders are very common. And 30% of adults at some point in their life have anxiety disorder. And anxiety disorder are more common in highly urbanized cities than the rural areas. This is because life in the city is more stressful than in rural areas. How do you know if your children has anxiety disorders? It is normal to feel some amount of anxiety, worry at a certain point. For example, a child is scared of a thunderstorm. So this is just normal. It becomes abnormal if a child approaches the situation with overwhelming fear and they can stop thinking about a certain event. And none of your comfort helps. And usually, they got stuck to their worries. And they have a hard time doing their daily activities like school, going to school, and they cannot do their school activities. And it also interfere with their sleep. And these children usually are reluctant to try something new. So the key sign is they got stuck to their worry. This separate from regular worry. If their worry interferes with your child's ability to function, it may be time to seek help. What causes anxiety disorder? Combination of factors play a role. First, chemical imbalance. If a person is exposed to a severe long stress, this causes changes in chemical balance and can lead to anxiety disorder. Another factor is the environment or environmental factors. Example of this is stressful work environment. Another thing that can contribute to anxiety disorder is heredity. Anxiety disorder tend to run in families. Another factor that may lead to anxiety disorder is a person's life experience, his upbringing, and his attitude. What are the symptoms of anxiety disorder? First are the physical symptoms like cold or sweaty hands, dry mouth, heart palpitations or rapid heartbeats, nausea and vomiting, numbness, muscle tension, shortness of breath, chest pains, headaches, and gastrointestinal issues. Mental symptoms of anxiety disorder. A person can have a feeling of fear and uneasiness. A person may have nightmares and may have repetitive thoughts of traumatic experience. And another is uncontrollable obsessive thought and inability to concentrate. Behavioral symptoms of ADO. First is the inability to stay still and calm. And usually the person do ritualistic behaviors. Example, frequent and repeated hand washing, repeated checking of door locks, and a person usually have trouble sleeping. Anxiety disorder in children. Anxiety disorder in children is the fear or fixation that interfere with daily activity or tasks. And this usually does not improve after logical explanation. However, the good news is anxiety disorder in children is treatable. Many adults hesitate effective treatment because it is easier to avoid stimulus that causes the symptoms. A person tries to avoid the situation and feel better at the moment. However, avoidance worsens anxiety symptoms and will fuel the long-term fear without addressing the underlying issue. How anxiety disorder is diagnosed? Is it diagnosed through lab tests or scans? No. But doctors may run tests to rule out medical conditions that may be causing the symptoms. It is diagnosed through complete medical history and physical exams. Your doctor may ask you your repeated symptoms, how intense it is, and how long. And your doctor will also elicit if your symptoms interfere with daily life. And your doctor will also ask you if your symptoms interfere with your daily life. Though the doctor may also observe your attitude and behavior while talking to you. And the doctor may validate through mental status exam. Who can diagnose anxiety disorder? Your primary doctor can diagnose anxiety disorder. And if there's a need, the primary doctor may refer you to a psychiatrist or psychologist. Management and treatment of ADO. Combination of medications and psychotherapy are the most effective mode of treatment. So what are the medicines used? Number one is the anti-anxiety meds or anxiolytics. These are called the benzodiazepines. Benzodiazepines decreases anxiety and it works quickly. The onset of which after taking the medicine is 30 minutes. However, benzodiazepines have tolerance. It means to say, if you use the drug for a long time, you need to have a higher dose because you have developed tolerance. So it is less effective over time. These medication, the anxiolytics or benzodiazepines are used for short-term use only. Next medication is the antidepressants, the SSRI, selective serotonin reuptake inhibitors. These medicines trick the brain to decrease the reabsorption of serotonin, which will lead to improve mood and reduce anxiety. This medication takes time to work. Usually, we need 4 to 6 weeks before we could see some improvement of the symptoms. So, this SSRI is used for chronic anxiety symptoms. Another medications that will help in the treatment is the antihistamines. Antihistamines are used in allergies. They produce calming relief without risk of withdrawal symptoms. Examples of antihistamines are the diphenhydramine, hydroxyzine, and chlorpheniramine. Another drugs that are used for anxiety are the beta blockers. Beta blockers usually are used in high blood pressures. These are the olols, the propanolol, atenolol, and carvedilol. I want to emphasize to you that in treatment, it is important to comply with the prescription and don't change the dose without consulting your doctors. Meds might have negative side effects if you alter the dosage. Another modality of treatment of anxiety disorder is the psychotherapy. Under psychotherapy is the cognitive behavioral therapy or CBT. In CBT, it teaches to recognize thought pattern and behavior that leads to troublesome feelings. Then teaches you to work on changing them and learn how to change negative thought pattern. Second, under psychotherapy is the exposure therapy. In exposure therapy, it helps you engage with activities or situations you have been avoiding. Another, under psychotherapy, is the relaxation exercises, like the yoga and meditation. Another, under psychotherapy, is the supplemental therapies, like recreational therapy, art therapy, and music therapy. These supplemental therapies provide creative and physical outlet, which will lead to a regained control of your life. Supplemental therapies are not a traditional style of therapy, but helps patients achieve recovery goals. What happens if you don't get treatment for a child with ADO? If you seek help, it will lead to improvement in their development, and it will lead to the self-esteem of a child. However, if you don't seek help, this can lead to harm family relationship. It can lead to poor school performance. It can also lead to poor social functioning and may end up in a more serious and physical mental problem. The good news is ADO can be treated. Children can become their best. So what are the steps to reduce your symptoms? First, you have to check your medications that you're taking. Over-the-counter drugs and herbal medicines may contain ingredients that may lead to the worsening of the symptoms of ADO. It also helps if you reduce or limit your caffeine intake. So, avoid coffee, tea, colas, and chocos. Third, it also helps if you have a healthy lifestyle, like regular exercise and eating healthy and balanced diet. Another step is to seek help, like getting counseling and support. So what is the prognosis or outlook of ADO? If undiagnosed or untreated, this will lead to a lower quality of life, poor family relationship, and less productive person. If you get the right treatment, this will lead to a better quality of life. It will lead to a better family relationship. And the person can be more productive. And it will lead to better overall health being. So how to cope with anxiety disorder? First, explore stress management, like rest and recreation. Prayer also help. Meditation and yoga. Second, join a support group like your church, your pastor, and other organization. Third, get educated. The more you learn about ADO and your health in general can help you cope with ADO. And also, most importantly, talk to your doctor. Your doctor is your partner in your health. If you have to consult a doctor, what are the things you have to ask if you have ADO? You may ask your doctor, what is the best treatment for you? You may ask him, do I need medication and what type of medication? And you may also ask him, how long should you take your medicine? You may also ask him what kind of psychotherapy will work best. And you may also ask what conditions am I risk for. So with that, I want to give my own personal advice. A note from yours truly. First, you cannot totally eliminate all the stressful situation in life. In John chapter 16 verse 33, it says, in the world you shall have tribulations, trials, and distress. But take courage, be of good cheer, for I have overcome the world and conquered it for you. Also, in Psalm chapter 34 verse 19, it says, many are the afflictions of the righteous, but the Lord delivers him out of them all. Second advice I want to give you is, you don't have to constantly worry and fear. In Psalm chapter 46 verse 10, it says, "Be still and know that I am your God." Third advice from me is, find the right coping method to reduce your stress. In Matthew chapter 11 verse 2, Jesus invites us, "Come to me, all of you who are weary and burdened, and I will give you rest." Fourth advice, seek effective treatment. Seek the ultimate healer. In Jeremiah chapter 30 verse 17, it says, "For I will restore health to you, and your wounds I will heal, declares the Lord." And also in Jeremiah chapter 33 verse 6, it says, "Behold, I will bring health and healing, and I will heal them and rebuild them abundance of prosperity and security." Thank you so much. I hope you learned something on this segment. If you learned something, kindly like and subscribe and comment on my channel. Thank you so much. May God bless you all.